Talking with Dr. David Klein of the Stages of Life Institute in Longwood. And the topic today is antidepressant.
Interesting problem, eh?
Mm-hmm.
All right. Depression is kind of an interesting problem in and of itself. It's one of those sorts of things that will affect the population, about 1/3 of the adults during their entire lifetime. Arguably a little bit more. But of those individuals, recurrent depression is really more the rule rather than the exception. It happens that way. Depression is very, very common, and you would think it would be a minor issue, but it does, in fact, cause a lot of people their lives.
Mm-hmm.
Okay, how does depression kill? Usually by self-inflicted wound or some other exogenous substance. It could be alcohol, could be drugs, could be a lot of things. But depression's serious. Depression is serious business. Treatment of depression is very serious business. But you need to understand that there are lots of ways to treat depression, just as there are lots of reasons for the depression to begin with. The most common cause of depression in our society is lack of proper sleep or sleep hygiene. You can make anybody at all, depressed. You can make them clinically depressed. You can make it irreversible, in fact, by depriving them of them sleep long enough. That's just the way that these things go.
Mm-hmm.
Sleep deprivation causes depression. Treatment of depression actually should start with getting people back into more normal sleep cycles. So before you start looking for a pill, before you start looking for a treatment to deal with your depression, that stuff the kids are telling you about, gee, mom, why are you moping? Gee, dad, why are you not being interested in us, or so on and so forth, or even with the kids. Okay, why is Junior wearing all black, looking for tattoos, and, watching all Johnny Depp movies? It's the sort of thing that you'd have to worry about. Okay, so sleep is number one. So these cell phones that we have, marvelous invention as they are, it's very hard to escape, very hard to not be connected. It's very, very difficult to find yourself alone, if you want to be alone, in the presence of a cell phone society. One of my favorite things to do is to go out to eat and simply watch other people not engage with folks on the other side of the table, because they're all sitting back talking about their meal with people that are living in other states or other countries.
Yep.
It makes no sense. But what these things do, in addition to watch the family dissolve into nothing, is that the kids leave these phones. The adults leave these phones at bedside because they are too important to not miss those 3 a.m. telephone calls from somebody who can't get to sleep. Somebody has some issue that can't wait until after breakfast in the morning or sometime the following day. Gone are the days when we worried about when we called people on the phone. Can't call now, it's dinner time. Can't call now, it's time to go to church. Can't call right now, it is breakfast time. Can't call now because the person's at work. Now people are taking telephone calls all day long, disrupting normal behaviors, and they're wondering why they're becoming increasingly depressed. So the first thing you need to do in the treatment of depression is to take away the cell phones. Watch people go into withdrawal. It's the darndest thing. Take your phone and leave it in the kitchen when you go to bed. Well, I can't do that. What if my kids call? Well, I'll tell you what. I have parents also. Okay, and if I called in the middle of the night, it had best be for somebody dying, most notably me. Why? Okay, because there's nothing other than just terrible, just this biblical level, disasters that should wake another person up from a slumber. That is the way that it goes. It should be just of catastrophic nature to pull somebody away from their dinner. It should be catastrophic to pull them away from their family time. Yet we've lost consideration for each other as a result, and now we're paying the toll. So what do? First thing you want to do is to watch the telephone use and misuse. If it goes under your pillow at night, you're doomed. Okay, you're done. You're finished. Kaput. You are going to get sicker and sicker and sicker, and that's just the way it's going to go. So the phones have to go away. The kids' phones have to be turned off or put away. They certainly don't have any friends that are so important that they need to reach them at 2 o'clock in the morning. There's no reason why they shouldn't be asleep at 11 or 11:30 at night, if not earlier. There's no particular reason for these behaviors, and we are responsible for making ourselves sick and making our kids sick. That's the way it goes. What about food? What sorts of foods can make you depressed? Well, that's an easy one, actually. Alcohol, number one. Okay, you watch the old movies from the 1940s where the guy goes into the bar, he just kind of mopes his way in there, sits down, and has a double bourbon neat. Okay, now it doesn't make him And it doesn't act as an antidepressant. They simply slump over and the depression gets worse. I'm going to drink myself into oblivion. Okay, brilliant. Okay, alcohol is a depressant. That's the way that it goes. Okay, so alcohol can be a contributing cause to these things. Well, what about drugs like Valium? What about drugs that are sleeping medications? Yeah, it's true. They're anxiolytics. They make you feel a bit better, but they're also depressants. So if you suffer from depression, taking a depressant makes little or no sense. Okay? Now, there are exceptions to every rule, and I'm sure there's somebody out there going, wow, what do you do if you can't sleep and then that causes depression? And the answer is absolutely true. Okay, there is a time and a place for benzodiazepines to help people sleep, but there are smarter medications to use. So it all depends on how clever you are. You can knock anybody out with medications that aren't going to be further depressing in their nature. So now let's say that you're on antidepressants. Okay, now one of the beauties in modern antidepressants, now we're not talking about the tricyclics of years ago or the MAOIs. Now those of you that have taken those know what that's all about. They're impossible medications because they have a tendency to cause side effect issues that can be life-threatening. So with the introduction of Prozac, something called an SSRI, selective serotonin reuptake inhibitor, we thought as a medical community that we were in nirvana, quite literally, as it turns out, that by giving Prozac, we would have Prozac society and everybody would be happier and da-da-da-da-da-da. You know, it didn't turn out that way. Why? Because, well, while it's true that serotonin is an important neurotransmitter regarding depression, it's not the only one. That's the first problem. The second problem is something called tachyphylaxis. Now, what this is where the body becomes adapted to a medication, then it either needs more for it to work or it stops working altogether. And this is where the meat and potatoes of this discussion is coming from. What do I do to get off my Serzone? What do I do to get off my Effexor? What do I do to get off my Prozac? And it becomes a real drag because not only is it not helping the depression, but as you start to back the dosage down, you start getting sicker. That is a big, big problem. So my recommendation is this, that as you start to see the depression wane, you start to back the dosage down, but there's something called 5-hydroxytryptophan, or 5-HTP. You start substituting that as you start the weaning process. Why? Because it's not just a matter of how much serotonin is in the neural cleft. That's cute. Can't measure it, okay, but it's cute. But by increasing the amount of serotonin altogether, by giving the precursor, wouldn't you know it, it's an antidepressant by itself. So my preferred means and mechanism to treat depression is not to go straight to the SSRIs or the SNRIs. Heck no. So I'll start with 5-hydroxytryptophan, which is a brilliant medication, glycine, which is another amino acid, okay, and you can start treating the depression in a means and manner that does not cause rebound issues and it doesn't cause side effect problems. So looking back at the many, many years of my use of these antidepressants, I was the number 2 prescribing physician for antidepressants in the state of Virginia, which is a heck of a statement for an anesthesiologist to make. But so I have some experience with it and a whole host of regrets, about 17 years worth of regrets. Okay, and that is, don't believe that these things are non-addictive, because they are. They're highly addictive. Anybody that wants to come off of Effexor is going to know exactly what I'm talking about. No, it is a misery. Somebody who wants to come off Prozac, generic or not, doesn't make any difference, is going to know exactly what I'm talking about. It's a gradual process. It's something that you need to do, but don't be tempted to substitute another addictive substance for the one that you're trying to remove yourself. It just doesn't work that way. So 5-hydroxytryptophan, get a good night's rest. Take the cell phones out of your life if you can, but certainly out of your bedroom. Do this for the rest of your family. You're going to be a whole lot healthier and a whole lot happier. Let's see if we can't break this depression cycle that way.
All right, very good. That's Dr. David Klein. Now, if you want to know more about the practice, which is located just off of I-4 in Longwood, simply go to suffernomore.com. And if you want to get on a good nutraceutical regimen, like the 5-HTP and melatonin and things like that, you go ahead and join the program, stagesoflifevitamins.com. That's stagesoflifevitamins.com, and we'll talk to the doctor yet again tomorrow.